My name is Dr. Prashant Sharma. I'm an ENT specialist at Prime Hospital. I'll be speaking on hearing loss. The hearing loss is a major drawback to the society. There are approximately 360 million people with hearing loss. When I talk of hearing loss, it means a profound to severe hearing loss. This is a fairly major problem in our society. Hearing loss not only impairs the hearing but overall affects the personality of a person. It affects the communication skills, it affects the occupational liabilities, and it overall leads to a lot of other things like depression, chronic disorders. The idea of hearing loss is sooner it is detected, the better it is, especially for kids. A lot of time we see children not able to speak at an appropriate age, and the first question we ask is, why are they not able to speak? Perhaps they are not hearing well, and that is the time when we pick up children with a hearing loss. There is a program of neonatal screening. In this, we identify children born normally to normal parents and see if there is any hearing issues with them. There is a special test which approximately takes just a minute to detect whether the child has a hearing issue or not. If there is a hearing issue, we counsel the parents accordingly, and depending on that, a subsequent program is started. If a child has a hearing issue, we try to identify what is the reason for it. Is it genetic or is it something which is different, like an infection? If it is infection, it is very much treatable. If it is genetic, that needs to be treated with some programs like an implant. Now, these implants are just like micro gadgets or computers which pick up the sound from an external environment, convert it into an electrical energy and transmits it through the hearing nerve to the brain. This is a life-changing event for a child who is born deaf at birth and starts hearing. So hearing implants are a major contribution of science to the society, and hearing loss is the only loss which is treatable as per the special senses of others like vision, skin, touch, which are perhaps still not treatable. These kids usually do very well when they're treated with the implants. They go in for a rehabilitation program, they start developing their speech and subsequently do very well in society. Pertaining to adults, we also notice that there are a lot of adults coming up with hearing losses. Most common is basically the hearing loss related to the age, which we call as presbyopia in medical terms. This is treated with some medicines and with a hearing aid. If the child or if the adult is not very comfortable with the hearing aid, he may also be benefited with some other surgical procedures which are not the first step to be done for a hearing loss in an adult. Of course, if there is an infection, if there is a hole in the eardrum, that is to be treated subsequently with the medicines or surgery repairing the drum or the middle ear bones if required.